dress up and show up and listen in on Ramadan Radio. And you can be ready to call us on 0116 482 2086. And you can even text or WhatsApp us on 077 488 55055. Of course, we continue. Today is our last day for discussing the impact of COVID in the last 3 years upon all of us. And today I have with me here our resident, regular, Dr. Saima. Good morning to you. Can you hear me?
Assalamu alaikum, Zaid, and good morning.
Good morning. I hope all is well with you, where you are.
Yes, very well, thank you. It's almost been a week since Ramadan on the East Coast, just as it has been for you guys.
Yeah, of course. We're all here recovering from the debacle of yesterday in Pakistan, as we all saw with distress, the resignation of Imran Khan. And it's a very sad moment in history. So, very upsetting indeed.
Yes, so I think history has been written in a way that is hard to decipher as it unfolds. However, time will be the best judge of whether this was a good move or a bad move. And we can only hope and pray for the best for the Muslim Ummah.
Of course, that's all we can do. Now we move on today. COVID, health and wellness. How is it all connected? It's almost 3 years now. In fact, it is about 3 years exactly from 2019 when we were first in lockdown around period March, April, May, June, and so on, right up to 2022. And we're just about now out of restrictions, out of lockdown, but the impact of it and what happens next is absolutely important for all of us to adhere to, right? Our behavior, our mental well-being, all the changes that happen in COVID, and how we're going to all deal with that. Dr. Saima.
Certainly, that we've been through very unprecedented times in the last couple of years, 2 years and counting. And we have to understand that so many things have been new to us, and so many things we've lived through, and we are reliving it as days pass. We've all become sort of immune to the idea of being in these COVID times now. And I use the word immune with pun intended, as in immune to the idea of it, immune to the effects of it, immune to the infections sometimes. We are going through a whole host of stressors on our psyches as a result. There have been behavioral, mental health changes and challenges that we faced as individuals and as a society. And we've always pondered through these times what it is that we can do to get through it in a safe and nurturing and wholesome environment, and with a view to wellness. We need to understand that as COVID has unfolded for us, awareness and information has been key. We've been bombarded by the media outlets and other blog posts and people telling us all about the virus itself. That's been key to understanding the issue. Once you understand the issue at hand, you understand that there might be repercussions of the problem, which is to go into quarantine. Quarantine has called for isolation, or even sometimes self-isolation or social isolation, as in keeping yourself away, not being socially mingling, workplace-wise, with your friends and families. And that has taken a toll. We've understood that effective communication is essential in these times, to be able to talk to each other, even on the phone, to connect with your peers and your friends and your support systems, without being able to see them one-on-one. We've understood that when we are surrounded in such circumstances that we can't go out and reach out, and some of us don't have the liberty to even, or the freedom, or even the resources sometimes to get supplies, whether they be medical if somebody's sick, or day-to-day household items, that has become a challenge. The supply issue has been addressed by governments and communities on a smaller scale. Those are the kinds of things that make up how we react and relate to these issues as we face them. So, it's imperative that we understand that we keep a line of supply available to us at all times during these times. We've asked our community members, for instance, over here, to reach out to people if they don't reach out to you, because that's a part of like checking in on one another as well. That keeps us mentally healthy, keeps us sane. Quarantine has been so difficult. So many different countries have different requirements for quarantine. You can be in one part of the world where it's 3 days, the other part of the world where it's 5 days. We should understand that the duration varies from region to region, but people, when they're limited and in quarantine and they're isolated, they lose a lot of their liberty. And that liberty kind of sets them back. And it's kind of like, it's a stark contrast to the way they're used to living their lives. So it's a stressor. So health authorities and communities as a whole need to address this and emphasize this more as an altruistic gesture from the ends of those who are undergoing it, for the reasons of safety for others. Things of these nature are very crucial that we understand as a whole, as a society, and that we propagate the awareness that we have about it.
Of course, communication is key here, and throughout the 3 years, throughout the world, every country had different facilities, different modes of communication, and communication is key. That is absolutely made clear, that even now, the effects of COVID from the last 3 years have impacted on all of us and how we are going to move forward with our health issues and all the impact on our stress levels, on our mental health also. We have to get to understand by communicating with the right people so we know which way to go forward, because by no means the mental health issue can be swept aside. It's going to be here with us for some time, almost like a war-like situation where many people have suffered and they go into a mode of PTSD and so on. So many people out there throughout the world, if you're listening in right now, you will know somebody somewhere in your vicinity, in your relatives, your family, and you got to learn how you're going to deal with them, how you're going to help them, how you're going to assist them in whichever way you can to come over these last 3 years of COVID. So this is what I want to emphasize to you all. Quarantine was different in different countries, as you mentioned earlier on. We were here for 10 days, then 7 days, then we had the travel quarantine, and that was a very, very, very stressful moment. Myself being a traveler, you could not travel easily. It was, in fact, almost not possible when you're going from one country to another. So the quarantine periods were prevalent there as well. I remember I got stuck in Turkey and I was just passing through, and I decided to take a day or two in Turkey, and that ended up costing me 10 days, because on the second day I was contacted in the hotel to say that I have to quarantine here for 10 days. And that's when I was on the way back to the UK. So these are stories throughout the world. Everybody has gone through them, and we need to have different experiences, shared experiences, common differences across the world, and deal with them. So the restriction of liberty, that is something that has been also prevalent during the period of COVID. How did you have that in your part of the world? The restrictions, how did you deal with them?
So the very first incidents where there was a first wave of COVID in 2020, spring through summer, was very isolating.
No, 2019 it was.
20,
Was
I
it
think
19?
it was 2020 and 2020 and beginning of 2020. And we went through this period where it was completely unprecedented. Nobody knew what to expect. And when it unfolded, it was a complete surprise to people. Businesses were shut down, offices were shut down, commercial was shut down, schools were shut down. We were just staying at home. And for endless hours and days, And we were confining ourselves to even seeing our friends or families, extended families, and that was really hard for people to adapt to. As a result, some people went into extreme forms of traumatic stress, and the stress caused further worsening of conditions in those who were predisposed to it. For instance, those who already suffered depressive symptoms or anxiety symptoms. And we saw a huge, steep increase in mental health issues being brought forth to clinical providers, and these services kind of escalated. They escalated the service lines, and they took care of their patients, especially in our part of the world. And quarantine was sometimes restricted to travel only, other times to like no travel to other areas, just confine yourselves to the neighborhoods that you're in. So, we've seen it all, and when the businesses shut down, we saw this huge shift in disparities as far as class and equality and financial class, and how the earning potential, and the rich became richer, the poor became poorer. In fact, the World Bank then estimated then that about 97 million people across the globe fell into poverty due to the pandemic, and they were living on less than $2 a day. Can you imagine? And even
Well,
as tens of millions.
I would be here to challenge that, because when I've been traveling in the third world countries, right, $1 would be more realistic than $2. $2, somebody would be over the moon with that, but realistically, I'm telling you, that figure is $1 or no dollar, and you're living on just a staple 7 days a week, 3 times a day, and that's
We're
how.
talking about averages, Zed, in
Yeah,
the
that's
rest of
how
the
bad
world.
it is really bad, the disparity.
So I will definitely support you in that statement. You might have seen places in this world, and I know you're an avid traveler to all parts of the world, that there might be a stark difference, even lower than $1 a day, for
Yeah,
instance.
or
But these are
nothing, or nothing.
present.
And
So the
add to that is the contaminated water to drink, and that's a reality. When you're on the ground, this is what you see, and sad situation.
Very sad. So say for instance, they said that in 2020, billionaires enjoyed the biggest boost on to their share of wealth on the record, and it took just 9 months for the world's 1,000 richest people to reclaim their fortunes during the pandemic year. But it could be more than a decade for those who were very, very poor to come back to what they were used to, and sometimes even not. So think of it this way: the global middle class went from, you know, 54 million fewer people in that year when the pandemic started. And the number of the poor was estimated to have jumped to 131 million more people because of the recession that it caused. So that's very, very steep, and it's very pronounced. And to the eye, it's almost invisible because people like ourselves, we keep about living our daily lives the way we're used to, except for the restriction bit, physical restriction bit. But what about people who don't have anything? I was recently reading a news article that a young family from Bangladesh, lost their means of acquiring a meal. They had to rely on charitable giving. And once they did come back, after the first 2 years, they were able to get a small business loan. That's when their life started, and their baby was born through that time, and the baby's now 6 months old. And anecdotally, for a lot of these families, this is a representative a class of society that has nothing, and their biggest aspiration at this point is, I hope that my baby's able to grow up and go to graduate school, so I'm not a day worker or a shift worker, and I'm not relying on an hourly wage. And these are the people that are laid off. So think about those. They said that the drop off in the global middle class was centered mostly around South Asia and Bangladesh, with all these factory workers. Just imagine the vastness of this. It's hard to imagine sitting here, but if we spread the word, perhaps you and I can spread the awareness that'll cause people to reach out and help those that need it.
Well, I'd like to start with rich and with poor. everywhere throughout the world, wherever you're listening in right now, this is what it's all about. You have rich areas and you have poor areas, and the poor areas were affected most with the COVID throughout the world, wherever you are in your country. A lot of poor people. It's estimated that it's going to take up to 10 years for them to recover from COVID. Now, the sad thing is, people don't have a very good recollection of history. We're talking about COVID starting in Wuhan, and people don't even remember what year that was, what month that was. They forget. This is the world we're living in today, that you struggle to remember what happened yesterday, day before, right? And if you don't know yesterday, we always say here on Radio Ramadan that if you don't know yesterday, you're not going to know today, and you're certainly not going to make it better tomorrow. So that's where we are with this issue, the rich and the poor areas we are talking about. Along with that will come people, rich people, poor people. And what we can do now is create awareness. Don't just put it under the carpet, talk about it, bring it onto the table, and support each other. Are you ready for that, Dr. Saima?
I am at your beck and call.
So we have a situation where a young child will have up to 20 moments of enthusiasm a day. Experience that. And an adult, I'm sorry, it doesn't even reach to 3 against 20. So sometimes you wonder, do we hand over the reins to the young people who are having these moments of enthusiasm and inspiration, and they are the ones that we need to invest in to bring change for tomorrow's world, to make a better world, the young people of this world who are in abundance in every country.
You'd be surprised that, the call went out to include 3 richest people in the world, who they said if they were to put aside just 2% of their incomes, including namely Elon Musk, they could wipe out using about $6 billion of that wealth to wipe out world poverty and reduce hunger. This went out through the UN's World Food Program. And if this were to be the case, it's not that complicated. Think about it. 6 billion help 42 million people, 2% of their wealth. That's not a big call.
So we're talking about rich and we're talking about poor. So that
we're talking about rich feeding the hungry.
Rich feeding the hungry.
Entirely theoretically possible.
Now that brings me and reminds me of yesterday. We had a program with a wonderful gentleman. He's called Alex Smith. And in fact, the program was called Who is Alex Smith? And when we were discussing Zakat with him, we were running a program yesterday called, we brought in a section there called A to Z, the letter A to the letter Z, which is the taxes that we pay in this country, in the UK. So, for example, the letter C will stand for the cigarette tax, the letter A will stand for the alcohol tax, and every letter denotes a tax that we pay somewhere along the line. And a caller told us the best of these letters is the letter Z. Of course, that put a big smile on my face because I thought he was talking about me. But no, he was talking about the Zakat tax, the tax of Zakat, the 2.5% that we have to pay from our profits in our business. And Alex Smith was listening in, and we explained a little to him, and he volunteered. He said, I like this tax. I think it makes sense. And I'm happy to give 2.5% of a certain product range that I'm doing in my business and to donate that to your recommended charity. So that is something we have to share with everybody, that in our deen, the issue of zakat and the 2.5%. And you shared that story with the non-Muslims even, explain the merit of that, the essence of that, and they will come back and respond in a positive manner. So that made me very happy, Dr. Saima.
That's a really great story, Zed. And I think if that reaches more people in our part of the world, it would have an impact, clearly, because there's a whole emphasis, a very wholesome emphasis on charitable giving in the US, which then accounts to tax subsidies and tax breaks as a result. Each year, it's April now, April 15th to 18th is our tax deadline in this country. And, the wealthy and the not so wealthy also strive towards charitable giving in this season. So it's very, fortunate that this season is coinciding with the season of giving in Ramadan as well. However, for us Muslims, we do realize and we emphasize that charitable giving otherwise from zakat giving may not be mixed together. And I'll tell you from a project that I'm trying to do with my graduating class at in a Pakistani med school with the government hospital, and we're trying to institute a mechanism by which zakat monies are kept clearly segregated and separated from the charitable donations that people might want to give. And in Pakistan, it can blur the lines, but we have to have a mufti or a scholar of Islam overseeing this process so that the charitable giving by zakat only goes to the zakat eligible. So there's a very fine line and a very strict set of guidelines that Muslims have to follow in order to even disperse those monies if there's zakat. So, that's just something I'm sure our viewers, some of them know, some of them don't. And for the general viewership of this channel and others, be careful where you donate zakat, who the zakat monies go to as well. It's advocated, Islam allows it, it actually warrants it as Muslims, that it should be one of the five, it is one of the five tenets, but it's our responsibility, the giver's responsibility to make sure it reaches those that are eligible. Zakat eligibility is a very hot topic.
Of course, often people will say, well, I've done my bit. It's between the receiver and Allah, because often you give money and it gets chewed up into overheads and expenses before it reaches its final destination. But the point is, zakat is to alleviate poverty and to support the needy. And be sure that if you're going to give your 2.5% of your earnings of your wealth across the board, that you ensure that it reaches exactly where it needs to reach. And that is something not so difficult for you to do. Don't just give and forget and say, oh, it's between you and Allah and me and Allah and so on. Make a little effort and do something about it. And also, most importantly, do talk to people about alleviating poverty and how zakat is one of the tenets for deen, like you have just mentioned, Dr. Saima, that it's very important, especially the non-Muslims, but whoever really, your family, your friends, your colleagues at work, this is the month of Ramadan, and these are the kind of things to share with each other. Take on the good and leave the bad, as they say, Dr. Saima.
Yeah, take the good, leave the bad, teach the tenets of Islam, do the basics, and the rest will take care of itself.
Yeah, so we move on now to, we get analysis from across the globe, everywhere. Different people are giving different stats up. And the one stat that is on the increase is always the poor. They're never on the decrease. They're always on the increase. What do you say about that?
Yeah, but then you also have to poverty is on the increase. The poverty alleviation programs from IMF schemes that are dispersed through the developing countries, as well as the World Bank that offsets a whole bunch of stats and data on it. And governments are trying their best. Private sector is trying to alleviate that and help somehow in all parts of the world. There are countries around the globe, I'm not going to name them, you and I know who they are, where the private charitable giving overshadows government programming. But governments are continuing to rebuild. They should also be focusing on reactivating the economy as they're trying to rebuild. That things that would generate employment, especially in the service sector, because who has been home? Hotel workers, right? Cafeteria workers, restaurant workers, service line workers in the front lines. Those are the people who have been asked to sit back and relax because there are no more service industry related jobs that are available to them because the commercial businesses have been shut down. So those kinds of things, if they get rebuilt, it's the hourly wage workers and these people who have been laid off that will be able to regain and some financial independence. We've seen a lot of gaps in employment, lost employment, gaps in education of those people who've sat home. If they were going to college, they've lost out on those courses. If they weren't going to college and just aware, like so much of the information was absorbed through just going out of their homes and meeting people and talking to other people and socializing, and all those channels just got absorbed in this whole pandemic as everyone sat home. So, to offset this, there were stimulus programs, say, for instance, in the US of A, where I am. We would get checks from the government depending on, wage and eligibility to offset some of the expenses. And those programs have not been rolled back. And they've overcome some of the fiscal pressures, but not all. It wasn't enough. And these governments should continue to support the poor with those stimulus packages if possible, because it's not enough time has passed for the economy to roll back to pre-pandemic times, and not enough employment has been created either. So, I don't know what's going on in the UK. Maybe, Zed, you can highlight some of the fiscal pressures that people are facing. But certainly, rolling back these stimulus programs at this time is not the answer. It would be the answer if it were to continue in this direction and also be able to fill in the employment gap.
Of course, all of these problems that you have discussed are global. They're not only local, national, they are absolutely global. So what we can do is learn from each other, and even we have to go across the globe to learn. That's what we need to do. So, for example, in each city, you have a lot of support structures from non-government organizations. Now, if they can partner more with the local government, national government, with schemes that are already prevalent, a lot of funding can come through, plus partnerships with the commercial sector and the local public and awareness. That would be absolutely the way forward. Awareness. There is not enough awareness of everything that goes on in your vicinity, in your city, in your county. The more awareness we have on the various different diversities that live in our city, the more we know how to deal with them. Otherwise, we are just, as they say, the blind leading the blind, like sheep in a field following the shepherd. That's where we will all end up.
I would beg to differ. I think even the very uneducated and the totally unexposed people at least know what COVID is. They know what the pandemic is or how it has hit them. They know there is something out there. So awareness in terms of knowing what they're dealing with is there. Vaccination has propped that effort furthermore and brought it up in their faces, because everybody has to have a vaccine now, and more, not just once, more than once, twice, thrice in some cases, fourth time depending on their age and years. So all of this has been a huge shock to people's systems, mentally and emotionally. So till you manage to control that health shock, it's very hard to think about, all the other facets of recovery in society. So the way forward, like you said, awareness, that's one way, but you have to invest in that somehow. And how do you invest in that? You have to make them understand that health is wealth. You have to strive for a very healthy society and a very resilient society. Right now, they're still going through the process, and they're suffering through the damage of that carnage that somehow came upon them, and they didn't know where it came from. So, the health shock has to be contained and maintained, which they're trying to do by giving out vaccination. But think about those places where there is very little vaccine availability. And that's not to say that the entire world has attained herd immunity just yet and vaccinations have been uniformly given up. There's a huge gap in vaccinations in different areas of the world. So there's vaccine inequality, just like we have, financial inequality, a class inequality. We have no equity in distribution. There have been governments that are hoarding stockpiles without realizing that vaccines will expire someday. They can't really sell them for a profit all the time. So some of the world's richest countries hoard shots. They buy up enough to vaccinate their population several times over, and then they fail to deliver them. So just locally in this our city in Philadelphia, USA, I've learned that one of my ex public health colleagues has been running a program where they get the vaccines that are left over and they've been hoarded and not given timely. They collect them and they give them out to those that need them. They've set up a call center, so to say, or a space, or a safe space for people to come and approach them and get these. And that's a great idea for other places too. They should this idea should catch on. If there's hoarding, people should be made aware somehow. Some people should contribute to taking the responsibility for this and just set up local programming around it and give it out, Unfortunately, in other communities in the US of A, one doctor in particular who belongs to our community was seen doing the same, and he was called out for it, and he was almost penalized for it, and he lost his job. And this was in the early days, but I think they realized, because it almost became like a moral of the story, or a lesson to be learned from this. And I think they've become a little bit looser and lax in their criteria for how unused vaccines are to be distributed. So there is that. That's a very, very ripe area for interrogation and for taking the message forth. Like, do not hoard the vaccines, make use of whatever's available. Government should not be hoarding them, and deliver them timely. That's the other thing. Distributors such as your
just a reminder, in some countries they have gone out of date because they were hoarding them.
That's right. So the challenge is to catch it before they expire, to catch that whole, resource inefficiency gap, so to say.
So what we're saying now, as the governments across the globe are looking to rebuild, they need to reactivate a lot of economic activity and invest in that to generate employment in all sectors. Earlier on you mentioned the service sector, but all the sectors across the board. If we do not reactivate, then we will have more suffering, especially in the lower sectors of our communities.
True. And, then also incentivizing behaviors. You have to somehow change mentalities and behaviors. And how do you do that? You kind of strive towards social engineering, thought processes. So much of what determines who comes to see us as patients or who comes to approach us for their health needs and well-being needs, it's outside of the reach of a patient-physician encounter. It's outside the reach of that one encounter. It's really like these untapped ways in which you can get populations and people in your society to change the way they think about wellness, or they think about how best they can keep themselves healthy. So, you have to leverage those untapped areas. For instance, engage in beneficial health-related behaviors, form friendships that might be beneficial to doing things like maybe going for as simple as a walk together. Like, I know you like going for a morning walk. If you didn't like going for a morning walk, and if a friend tapped on your door, knocked on your door and said, come with me, you'd be more motivated to do that, right? Simple as that. So social engineering, social behavior rewarding is a very ripe area for interrogation. Again, because it helps you to develop and maintain these behaviors and habits that then go a long way in not just preventing the disease, but protecting your health over time. And so, that needs to be incentivized.
That is very, very useful for everybody, that we need to get back on track. And these are the kind of things that we need to do. Otherwise, things are going to be worse for us, right? So there are many largely untapped ways of organizing these interactions. Now, one of the ways forward in the future is the crypto, isn't it? So if you can explain that.
So if you think about those would be like a symbolic health behavior, symbolic reward you would get as a result of doing something. So to understand how crypto works it's a technology that is based on blockchain. It's a specific technological development. And what it does is it produces something online virtually in the form of currency. We've been dealing with this virtual currency for a while now. And, like a sticker or a token or a poker chip in a game, now there's cryptocurrency. So there's many different programs, and there've been top rated, like 5 or 6 programs in the last couple of years that have come up that have benefited people in the health and well-being sphere, and also in other things. So say, for instance, one of the programs lets you collect tokens as an incentive for its activity and health reward system. And what that does, you participate in their research online. It's an app. So it's an app-based service. Everybody has a phone now. Even the poorest of the poor countries and the poorest of the poor communities, people are carrying around cell phones, whether it has an Android or an iOS system on it, that's irrespective. But as long as there's an app, you can tap into it. And it incentivizes people to use this as a gaming system. So they get on it, they game on it, they're a player in it. It works with their psychology, and it works on this platform to tap into the wellness marketplace. You collect coins, or you collect like a reward that hooks back you into the game, you can see your stats on a dashboard on a platform, and that way you keep using the thing, and then you're encouraged to spend what you earn on something that is even helpful. So things like that.
Like a health coin, yes.
It's like a health coin. They're called clinic coins, say, for instance, one of the companies. I didn't want to name names, but since you said so, a health coin.
So it's a clinic coin. So this is the shape of things to come in the future, right? We said the word crypto because people are aware about the cryptocurrency and the crypto coins that you buy. And now in the health sector, the future lies here, where a health coin, whatever name it's going to be, there'll be so many of them coming on board, where you will buy a coin, and that is your investment in your health, where you can then use that for your treatments across the globe.
You can use it for your treatments, you can use it for spa services, you can use it to set goals for your health and wellness and fitness. You can use these coins to purchase items of interest from other stores that it might be linked to. So it really incentivizes you to earn the coin. And once you've earned it, you want to spend it, because it's like this whole symbolic reward system. And there's no way you're going to say no to that, are you?
Not at all. And health and well-being, the program's been about health and well-being, how COVID has impacted upon our health and well-being. You've been listening to Zed with Dr. Saima Anis from the USA on Ramadan Radio 87.7 FM. And you can send us your WhatsApp messages, 077-48-855-055. We don't have time for any calls right now because we are almost coming to the end of the program. And next week, we'll continue with another exciting topic, which is all related to our health and well-being and the impacts that we have had over the last 2-3 years. And as we said earlier on, we must not forget. We should always look at yesterday to make a better today and an even better tomorrow. And that we can only do with awareness, Dr. Saima, from people like yourselves. So you guys...
Thank you, Zed, for the endorsement.
Yeah, you guys have to be at the top of your game to spread that awareness, not only locally, but nationally and globally, so that more people can become aware. The key word you said earlier on was app. Everything is app related. So maybe you need to connect with the world with an app yourself.
Perhaps Ramadan Radio can get enough funding from our viewers that we'll be able to develop our own app for the iOS and Android system. And that's almost like a plea to our listeners and our viewers today. And Zed will further carry that message across.
Amongst the other 100 messages on my list that I've got to carry across, a lot of things to do. Each year we do the radio, and we always say that every program should have an aim and objective for tomorrow. So you can carry on the remainder of the 11 months with a things to do list. And each year the radio is effective. So if you put 5 projects out and you're successful with one of them, then you feel good that you've attained a degree of success from the 1 month of Ramadan Radio. And that's what it's all about. Ramadan Radio is not only about doing one program, flash in the pan, and it's all done and dusted. It's ongoing forever. So whatever good we take out of it, then we have to expand on that. Like the hospital appeal, collectively from all the community, we raised the sum of £275,000, which is quite a lot of money, and that's for the new children's hospital. Although it was partly government funded, but partly it was funded by the community and also by the commercial sector. So this is what partnership's all about: the community being the public, the government, and the commercial sector. That is the perfect partnership.
What they call the public-private partnership.
Yeah, and if we work like that on many, many projects, we can respectively build better communities in our local environment, in our national environment. And of course, success in one part can also be success in another part, because this is what shared values is all about in our humanity, Dr. Saima. Would you agree with that?
Certainly, absolutely. We carry our successes on our shoulders across the globe. As we come across challenges, we try to solve them for ourselves and others by setting examples.
So just to remind all the listeners right now, we'll be doing a program today at 2 o'clock to 3 o'clock. It's about the Once Upon a Time, 50 years ago initiative. This is all about the Ugandan Asians who were expelled in 1972. So we'll be regularly running these programs throughout the month, and a reminder to everyone. And throughout the country, we have many activities going on to create a little bit of awareness, commemoration, remembrance. And people probably don't know it, but 500,000 people have died during a period of 10 years after that expulsion of the Ugandan Asians. So issues of refugees are not going to end. They're going to continue ongoing. Each 10 years, we've had a different decade, different set of refugees from war-torn countries. And we're going to talk about the preventive measures as to how can that be prevented. And it's all down to the rich and poor situation, Dr. Saima.
That's a very noble effort on your part, Zed. And I know you're Ugandan by birth. Are you?
Yes, I'm from Uganda.
And so that is an issue close to your heart, well respected amongst your peers in your community.
Yeah, East Africa. And the city I live in is predominantly was Ugandan Asians came here to this city. And interesting for you listeners right now, it's a city that told the Ugandan Asians, don't come to this city, you are not welcome. Now look at the contrast of that time, and look at the contrast of the Ukrainian refugees, where they are welcomed and they are being given so many incentives. And look at us, in 72 we were told not to come. So I'm like going back 50 years to today, and every decade the advent of refugees. And of course, that's how the world is. What we're going to do to change that mindset.
It's almost like the refugee crisis never ends. So for all of my clinical training, in Pakistan, it was like I was dealing with patients that were refugees from across the border, from Bangladesh, from Afghanistan, and it's like the circle of life, as so to say.
So what I will say is that we all can make a difference. Let's all be mad, make a difference, and do what we can. That's all we can say today, Dr. Saima. I guess you share that sentiment.
Words well appreciated, Zed.
Definitely. So that'll be today at 2 o'clock, from 2 till 3. We'll have some callers in who will share their experiences from 1972 and talk to us about that period. And we'll create as much awareness as we can. Maybe we can learn something from that period to how we can effect change during this period. So Dr. Saima, I'd like to thank you for taking part today in our program. Much appreciated, because you're in a time zone which is called the sleep zone. Thank you for that.
Well, you catch me right at Sehri time. So it's you're incentivizing my healthy behavior of eating suhoor.
Well, that is sure to be true. Now, I'll let you go today with the 3Ds, which is radio 3Ds. Do you know about them?
Discipline?
Discipline, yes, you got the first one right. The second one?
I'm missing the second and third. Please enlighten us.
Devotion, and the third one is the best one also. They all work together, is detoxification.
Perfect for Ramadan.
Now they reflect to the spirit of Ramadan. So all of you listening in, Jazakallah khair. And last words from you, from Dr. Saima.
Well, the devotion goes a long way. As soon as I'm finished, it's time for Fajr prayer.